Organs are extremely vital to our lives. You know the main ones: heart, liver, lungs, etc. But even your skin is an organ. Each organ is vital to your body's function and good health. When a single organ is damaged or begins to fail, your entire body is affected, and your life may be in danger. Luckily, organ donation has become a possibility. From one person, as many as 8 lives can be saved through organ donation. Right now, about 123,000 people currently need a working organ, and every 10 minutes, another name is added to the national waiting list. Sadly, an average of 21 people die every day due to organ failure, which could have been prevented by a donation. How can you help, you ask? It's simple. Become an organ donor. People of all ages and medical histories can be an organ donor, and it's very easy to sign up. Organs are matched by blood and tissue typing, size, medical urgency, wait time, and geographic location. For each organ, the exchange rate between bodies varies, so time and location is a very important factor. If you are an organ donor and get in a tragic accident, become sick, or have life-threatening injuries, the absolute #1 priority is to save your life. Organ donation can only be considered after a physician has declared brain death or cardiac death, and there is no possibility of recovery. Only then can your organs be used for someone's second chance at life. Being an organ donor, you have the potential to make a difference and provide the gift of life, the most amazing gift of all. For more information, visit www.unos.org.
Someone who is brain dead is an individual who has sustained either 1. Irreversible cessation of circulatory and respiratory functions, or 2. Irreversible cessation of all function of the entire brain, including the brainstem. Brain dead is not the same as coma. Some people argue about if someone who's declared brain dead is legally dead or not. As of now, someone who is brain dead is legally as dead as someone whose body is cold to the touch. There's currently a very big argument around our current dead donor rule, also known as a DDR, which lies at the heart of current organ procurement policy. The DDR is not a law or a regulation. It is a description of an ethical norm that an organ donor must be pronounced dead before vital organs are removed. The UDDA, along with the DDR, assures patients, families, and others that a patient who is brain dead is in fact dead, therefore making removal of vital organs for life-saving transplants legally and ethically acceptable. When someone is brain dead, other organs like the liver, however, can still work for only a short period of time with the help of life support. But when someone is declared brain dead, the person has died. This system has been in place for over 30 years and seems to be working sufficiently. However, there are lots of people who argue this system. Some people want to abandon the DDR because they see this current system as wrong. Some believe that the DDR diagnosis of brain death is seen as unreliable. They argue that patients who meet the criteria for brain death still have homeostatic functions in their brain, like temperature control, water, and electrolyte balance. They see someone who is brain dead, not officially dead. This argument still is a very heated topic amongst the public to this day.
About 6,000 of the organ donations that occur each year are due to living organ donors. This type of organ donation involves a living recipient who is in good physical and mental health and above the age of 18. The organs which are able to be donated through a living donor are the kidney, the liver, parts of the lung, parts of the pancreas, and parts of the intestines. The organ donation process occurs with a medical screening involving both a blood test to ensure that the intended donor or the matched donor is compatible with the recipient. After this occurs, an extensive evaluation of both psychological and medical history is involved to ensure that the transplant goes successfully and smoothly. Then surgery occurs once the donors are matched and compatible, and recovery of the surgery usually takes anywhere between 3 to 7 days for a kidney donor and upwards to a week or longer in the hospital for a liver donor. Usually in about 4 to 6 weeks or about 2 to 3 months, depending on the type of organ donation that has taken place, the recipient can return to normal activities as well as the donor. Now, usually following about 6, 12, and 24 months post-donation, both the donor and the recipient have a follow-up to ensure that everything is going smoothly and that there is no rejection within the transplant recipient. Organ donation is a wonderful way to donate to a loved one who maybe has a kidney disease or a non-functioning liver and etc., and allows for the donor to reap and see the benefits of their small and minute sacrifice that has allowed someone to continue on to a better life because of them.
The process of a kidney donation is very intensive. The entire process starts out with a series of 9 tests, including a general health test, a psychological test, urine tests, blood pressure tests, glucose tolerance tests, kidney tests, an ECG, and a chest x-ray. After these tests, the doctors decide if the person is able to donate. If so, the next step is for the donor to meet with a surgeon and discuss the logistics. After that, a compatibility test is done to find a recipient that can accept the donor's kidney. The fourth step is to meet with an independent assessor to ensure the donor understands exactly what they are doing and to make sure they want to proceed. Before the operation, final tests are done to make sure the donor is still in good health, and finally, the surgery is completed. A few benefits to a kidney donation are there is little to no wait time to receive a kidney, and the recipient's recovery is very short. There are many statistics regarding organ donations, and some of them are very interesting. The first one is that there are 114,000 people on the waiting list for an organ donation as of August 2017, and every 10 minutes a new person is added to that list. Of all of those on the list, 20 people die every day waiting on a transplant. In 2017, there were 42,609 organs donated, and of that number, there were only 34,770 transplants done in the whole year. Also, one person can save up to 8 lives being registered as an organ donor. This is because a single donor can give their heart, 2 lungs, their liver, their pancreas, 2 kidneys, and their intestines. As of 2017, 138 million people are registered to be an organ donor, and out of all 50 states, Montana has the highest rate of registered organ donors, with 89% of their population being registered. Like I said before, one donor can save up to 8 lives. To become an organ donor is actually pretty simple. According to organdonor.gov, there are 2 steps: making the decision to become a donor and registering either online or at your local BMV.